we've got crossroads because it's bigger than AI, right? So we can either grow the pie or fight for the scraps of a shrinking pie.
I like growing the pie.
I like it too.
Welcome to the podcast where we try to inspire better work performance. Thanks for listening.
Hey everyone. Thanks for joining us today on Management Muse. I'm your host, Cindi Baldi, and I am coming to you from beautiful Lake Winnipesaukee. Behind me is Pockus Bay, and I am standing in Weir's Beach, a place I love. So happy to bring it to you if you happen to be on YouTube or watching on Spotify. And so today, what I'd like to do is to continue a conversation that I started with Stacy Edgar on AI. And so while the headlines say AI is coming for your job, maybe that's not the case. What if AI is most powerful when we combine it alongside people to create better outcomes? This week, we are continuing that conversation with Stacy Edgar, co-founder and CEO of Venteur, an AI and digital health startup. We talk about how AI is changing healthcare, what it means for business leaders more broadly, and why the mindset you bring will determine whether your organization thrives in the age of AI. This episode is sponsored by the Uncertainty Playbook, 14 Strategies for Work Success in a Chaotic World, written by Jeffrey Tumlin and me. You can get your copy at the link in the description below, or you can just go to Amazon. It's there. And if you like the content we share here at Management Muse, please take a moment to subscribe. Now on to the episode.
Hello, Stacy. Thanks for joining us today.
Thank you so much for having me.
Your company markets itself as, AI driven. And so what are you seeing with AI in healthcare? What do you think is what's happening today and what's going to happen? Do you think be a futurist? What do you think is going to happen?
So there's a renaissance happening right now. Healthcare is a gold mine for AI because it has decades of data that up until some of the recent model changes have been unusable. And now because of, you have the different LLMs, different ways of training specifically unstructured data. I think we've been able to deal with structured data for decades. That's not new, but our ability to use unstructured data is a huge unlock. And you're seeing AI scribes, it's really in the workflow automation right now.
Right.
But now we're starting to see it and creep into clinical. My hot take is we will see an AI PCP, a primary care physician. And I actually look forward to that day because I don't really like going to the doctor, if I must be honest. The only thing is we have a higher bar on trusting AI than we do a human. And the biggest question in my mind is, what does safety look like? How do we prove that this is doing what it's the AI's recommendation or prediction or whatever is
being monitored.
Good for us?
Yeah.
Yes, and that's uncharted territory, and I don't think it's a solved problem yet. So that's probably the biggest blockage point of that, plus human emotion. Actually, the AI already can beat the doctors and practitioners in some things, not everything, some things, but humans get tired, machine doesn't.
The interesting thing about AI in terms of knowledge, and it's not even so much the tired, it's that a doctor spends years, sometimes decades, specializing, and they know that area of the body really, really well.
100%.
The problem is that the body is a system, and you might have a problem happening here or a symptom happening here, but it's actually getting kicked off somewhere else. So, I definitely had that when I had colon cancer. Wow. And I had continual infections elsewhere in the body. There was one particular part of my body where I was continually getting an infection. And I could have spent forever. I would go in, they would look, they'd put me on antibiotics. They had no idea. They were guessing why as soon as the tumor was removed.
Yeah.
infection gone?
You know what I love though, about, okay, so the medicine, all right, in my story, a hospital here in California offered my partner up and a robot surgery driven by AI, and like tried to sell it. Like they were like, this is so cool. And it's a major academic center. So, and his response was, no. So like I just want a human, and because you don't want to be first, right? Like I just said I look forward to the day where there's an AI PCP, but I will not be the first adopter. I will be like maybe the 100th or 1,000
I
or
think
something.
you kind of almost need. It's almost like the driverless cars.
Yeah,
there needs to be a time period where there are humans that are there to correct for. I mean, it's a new technology. New technologies are never flawless. And so you need a human there until like we have some confidence that the car can actually drive itself, or that the surgery can actually go on its own, on itself.
Yes.
But I do find it really like the database idea and AI being able to sort of connect the different systems in a way that a GP tries. And if you have a good GP, they're probably really good at it.
They'll do it. Yeah.
But it can be hard to even get into a good GP. Like we have layers now in between. And so of people who've spent less time studying the human body. And so the AI kind of helps maybe give a more overall view, whereas the human, it serves also, I think, as like just getting comfort and feeling a human taking care of you. Although there is some research out there that shows that we're connecting to AI just fine. I don't know. We'll see.
Yeah. I love though, I saw my parents do this, where before a doctor's visit, you run in your questions and into ChatGPT or Perplexity or whatever your platform of choice is. And then you can tell it, like, explain it to me like I'm 5, or tell me questions and indicators that I should ask my physician. And that's the part I love of helping consumers feel a little bit more powerful, or
it's reducing the knowledge asymmetry, which
100%.
Which I understand, like getting questioned really throws off experts and they, especially doctors, because like I think for so long, we're just kind of used to like the doctor tells you to do something and they have so much more information than you that you just sort of take it. Like, but I think it's an important thing that is happening because the systems are built now because of the way that hospitals, healthcare gets reimbursed, where, really the physician has 15 minutes with you. And a lot of the time I feel like they just don't, it's not that anything to do with their abilities, but I'm not sure that they actually have the time to thoughtfully think about you. So you have to thoughtfully think about you before you go in. And yet you're not qualified to thoughtfully think about you. And so that's where I could see like the AI being helpful. But I am positive that healthcare is not going to like that.
Oh, I don't. And I'm here for that. I love that. So I don't particularly care. I love, have you ever noticed radiology reports in particular have so many double negatives in them? And so it's like, whoa, the LSAT is less complicated than this. But it's like their way of talking, right? It's a radiologist. Oh yeah,
they have a jargon for sure.
Yes. And so like you run that through ChatGPT and like you all of a sudden you're like, okay, this is an intimate conversation happening about my body that I'm finally invited to the table to discuss.
To understand.
So
yeah.
Yeah. So I think that part is good.
There's a funny story about that somebody I've worked with, and basically because of my chart, the person who was very much in shape, they were actually in one of the military services. So they were in very good shape and clearly valued that. And so anyway, as part of the assessment, the notes were abs unremarkable, which in doctor speak just means nothing's going on there. but they saw the remarks in my chart.
How
And
dare
they
you?
came back really upset because they thought their abs were remarkable. And I love that story. It makes me laugh every time I think about it. But that is the kind of thing that like AI might be able to be like,
no, they're just saying it's normal. You're good.
They're saying you're good.
Yeah. Yeah. Well, I think there's a whole healthcare future coming, and it's the technology's here. And where I sit, when AI means more personalization, AI means precision medicine. That level of personalization exists.
Yeah, I think that's the challenge with the system is that like it's not just one part of the system that can change everything, but AI is certainly a big force. And then how people interact with it. So you've got like kind of two components that are going on, like the capabilities of what can be done and then how the people are interacting with it. And then that drives what all the other players' reaction to it. But you almost kind of 100%. Need an external catalyst, and AI might be it.
I think AI could be it, because I think AI is already changed. It changes. I realize this is I'm in San Francisco. This is a very San Francisco thing to say. When I travel, people look at me funny. They're like, because I'm like, oh yeah, I take Waymo every day. Self-driving cars. That's normal.
I would love to. I would love it. I'm not one of those people who's I don't think people are all that good of a driver, and so I would definitely trust a.
Waymo's so funny too. It's more human-like than I expected. Like I thought the AI would be kind of conservative, and it runs every yellow light. like whoa. So, but it also does it with like a computer brain. Or at least that's what I'm telling myself. I was like, I don't know that I would have made that move, but
it has the timing. It has the timing down. But like even that, like even something that seems fairly straightforward, self-driving cars. I mean, now it feels fairly straightforward. We've been talking about it for a long time. It's not. Like you need all the infrastructure for it. You need to figure out like legally, okay, when these things hit something, which will happen, who's responsible?
Yeah. That's also the funniest thing when like when a driver, you're driving on the road and you need to get in, and maybe you gesture at you wave your hand at the driver next to you, like, let me in, please. And like I was in a Waymo a couple months ago, and somebody was doing that to the car, like gesturing, like, let me in, and they like turn over, look back, and saw no driver, and the facial expression. It was so good. So I have to give credit to the Waymo team for the amount of design work they've done to signal, like have the car be able to communicate with others on the road is incredible on a feat of technology. And it's a microcosm of what can be done in terms of what the product looks like, but it's changing. It tells us AI is a more profound change in society than any of us might realize. I think it's changing already how we consume information, how we validate it's true, which means it's changing how we distribute product and go to market and sell and interact, and changing how we move here in the city of San Francisco to an extent. And there's more coming for sure. So, and it will change. It's changing healthcare. I think we're in the beginning of that. It's way easier to tell, to measure a car and say, like, is it safe, right? Is it like following the track versus like measure AI across a diagnosis or recommendation or an action over time on the human body.
If it's done right, we would be early, or we would be so early that we would actually prevent problems. But then like there's no measurement to show success, right? So when nothing happens, nothing's counted. And so, you know, it's hard to measure what doesn't happen is what I'm saying. And yet that's where the possibility is. It could get involved so early in the pipeline that it's like, listen, every time you eat that bag of chips, this is what happens to your body. It could get in that early, or it could just be like, hey, you know what? You're emitting a smell and we think that might be cancer. right? Which that's so complex. But we've been talking about all the good things about AI, but the problem is that like AI is now gutting some jobs and probably will gut more coming. I'm not doom and gloom on AI at all, but like that's adding to the labor pool, which then it's supply and demand. So the more people who need the jobs and the fewer jobs that are out there to get, the more power goes to the owner.
Well, we've got crossroads because it's bigger than AI, right? So we can either grow the pie or fight for the scraps of the shrinking pie.
I like growing the pie.
And I like it too. So like the more businesses in America that are hiring, that are healthy, that are growing, that are prosperous, that is a stronger tax base that then is funding different, like our roads, our schools, it's a virtuous cycle. Also healthcare for the certain safety net population. So like all of it goes together. Or if we take the kind of control approach of like, I'm going to squeeze my workers, pay the bare minimum, but then they're not really motivated or incentivized to help me to grow the pie and create value.
Yeah, they're going to give you the bare minimum to not get fired, to quote Office Space.
Yes,
paraphrase
and we're going to shrink the pie, and we're not going to see a growing economy because what's in it for them, and then that has a whole ripple effect. So I'd love us to see. I think the levers you talk about are, on one hand, when you hear them, I was thinking about it. I was like, are we the two populist management people? It's a power to the people, but which is not usually something you hear when you think about management philosophy or in a strict business context.
Honestly, I do feel like the people who understand in leadership in organizations, the people who understand the value that people can bring and don't treat them like machines or expendable, I think there's more of them than we think. If your management style is brutality on somebody who's weak, then you have basically opted to not develop any management skills.
Yeah.
And the power structure in the US, I mean, just look at minimum wage. And I know some of the states have changed the minimum wage, but it's $7.25 an hour. Who can live off of that?
You can't.
And
you can't.
And it's been that way, I think, since the 90s.
That's correct. Yeah.
And everybody else has been getting pay increases of 2 to 3% conservatively, usually when you stay in an organization, and yet our minimum wage hasn't changed.
It's worse than that, actually. Do you know that the minimum an employer has to spend on health insurance is either based off of wage or the federal poverty limit? And both of those clock in at around $15K a year on salary, like if you were to multiply it out. So the rule is the employee can't spend more than 9.05% of their income on health insurance premiums. And then you kind of do the math and you walk into it of this is how much I have to spend then. The problem is that when you're at that income level, that's maybe legally affordable. It is not functionally affordable. And I could go on and on about this. That's, you're right. It's like there's this the floor is alarming, and then there's this range between 15 to 20K to maybe even 30K, where it's that is a hard place to live as an American worker at the moment, given the cost of healthcare and the cost of housing. And on the management point of view, that's also really hard to manage too, as well, because your levers, I do see more businesses managed by force rather than by kind of.
That's where I was going. I mean, we've been in, aside from the Great Resignation.
Great Resignation, that one.
Aside from that little brief window of period, the power has generally always leaned towards the owner. But it's a symbol or a signal, I think more than a signal of just how much the power has shifted over to the owner, where there's just this huge gap between the two, and the people on the low end they haven't had any power until the Great Resignation, which was, where like organizations were scrambling because they had huge numbers of holes.
Yeah.
And so we had a little blip. But the problem with what we're talking about with like the minimum wage and the power dynamics is that basically, just like we were talking about with healthcare, where it's a system and you have to have external forces sort of impose some of the changes to happen, and that those external forces may be technological disruptions, or they may be political, or they may be government. I mean, there are a lot of external. Demographics is one that is disrupting everything. AI comes in, like the technology comes in, and it's been a big disruption. But I have been like reading books about like where we were at, and generally what I was picking up was we're very far off from having anything that's like a human mind in a computer because of we're actually very complex. And so I had been following it and still was surprised at just how great ChatGPT and now all these others are. I mean, what they can do is really remarkable. But, sometimes the disruption is, sometimes it comes and it brings rapid change, but usually people want a slower rate of change. They're better with evolution and not revolution. That's my observation.
Right. I think you're right. Also, unrelated story. A few weeks ago, we had a team member who said, I'm going to think about building an AI prototype that builds AI. And I was like, no, you're not. You're going to first watch the Terminator. And then you're going to tell me. You're going to tell me if that's.
It's important that we mentor those below us.
And then
we'll also put a link into Amazon for Terminator. I'm sure it's probably there. Like everybody needs to watch this because we are like this close.
Yeah, and this was a younger employee who was like, "What's the Terminator?" And I was like, "Yep, this required watching. Go." Let's talk about safety.
I almost think that needs to be put in schools, but it was rated R, so I don't think they'll allow it.
That's fair. Yes. But I mean, some of those, those sci-fi movies from the 80s and 90s, they had some good predictions.
Arthur C. Clarke, when he wrote like 2001 Space Odyssey, and did he predict the future, or was he just so brilliant that like in his interviews and things like that, like he basically was describing cell phones, and we weren't even close. So I don't know, were they predicting it, or is it because we love sci-fi that the sci-fi is creating it, or is it a combination of the two? But that's out there, and Terminator is frightening. And so we should be a little bit worried about whether or not that is actually creating our future environment.
I think it's coming. So, but like, luckily, I think there's a lot of smart people working on, asking good questions.
Drones, AI drones scare the daylights out of me. That's Terminator.
Yeah. The safety reports that the Anthropic and OpenAI publish are, I appreciate their transparency. They're, if you haven't read them, I encourage you to give, especially the one for, I think, Claude 4 from Anthropic. Give that a read. At some point, the AI blackmailed an employee, and the story was
the AI is becoming like the worst version of us. And I think it's got to be partly related to just learning off the internet, because the internet kind of gets the worst version of us.
Yeah, one argument, right, is wisdom of the masses, but then you also go stupidity of the masses too, right? The internet is a dark, dark, dark place as well as being
the stupidity of the masses. I like that.
I mean, tell me I'm wrong on that one, but yes, read that safety report. That was that. So, but also I have to respect the integrity of some of the companies building this space to release something that scary and to say this happened and this is what we're doing about it. So that gives me some hope.
Yeah. I mean, again, every technology has its flaws. Mm-hmm. And that's why we have to be driving the self-driving car for a little while. So yes. I'm glad that they're noting their failings and hopefully adding in the ethics to the technology.
I'll tell you one story about a self-driving car from recently. Majority of my car rides have been totally bland, innocent, like delightful. Recently, I had one where you go up to get in, and then it was like, no, I gotta move. And then it like moves 2 blocks and is like, here's your new pickup place. And then I like go chase it down. And then it did it again. It did this about 4 times. Like I got a workout in. Like I probably ran half a mile chasing this car, like around, like in a circle. So until I messaged support, I was like, please make this car stop so I can like get into it, or I'm gonna call an Uber. So this is like, I can't. So, but that's lighthearted compared to, at least we get like, I got some exercise that day, so that's good.
And who knows, maybe it was like, you haven't gotten your steps in.
Yeah, it knew. So I was synced to my Apple Watch and was like, girl,
that's right.
we need to get you moving.
It's looking at your calendar and your steps, and it's like, this is the moment.
Yeah, this is the moment. Yes. And she's never going to know. Let's go. So
I love it. That's awesome.
Yes. Well, it was so fun talking to you.
Yeah.
Today.
I thank you for being on. I really enjoyed talking to you. All right. Bye, Stacy.
Bye.
So to recap what we've talked about today, AI and disruption are probably the new standard, at least until we spend a little bit more time absorbing AI into our daily lives. And while that's making a whole lot of people nervous because it's difficult to predict what we as individuals need to do to be successful, what we do know is that staying still probably isn't going to work out so well for organizations. We can see AI as a problem or as the tremendous, probably once in a lifetime opportunity that I think it is. When no one knows what's coming, leaders have incredible latitude to create their own vision. My recommendation is it doesn't have to be like Terminator. My recommendation would be to make it beautiful and make it kind. All right, y'all. See you next time on Management Muse.
Thank you, everyone, for joining us today on Management Muse. We are a podcast/YouTube channel that we hope is entertaining and educational. If you are on YouTube, we would appreciate you subscribing and maybe leaving a comment and a like. If you are on any of the podcasts listening to this, we would appreciate stars, following, comments, all the good stuff. We want to say thank you to Sarah and Rebecca. And then just as a last minute reminder, we also want to mention that we are management and communication professionals working in the field, but also have degrees that back us in science. All that being said, we are talking in generalities on this podcast. We do not actually know your particular situation. So proceed with common sense and maybe a little bit of experimentation on your end. And we hope that you make the world a more beautiful place by making work a more enjoyable place. See you next time on Management Muse.